I'm Christina Nguyen, and I'm a licensed acupuncturist based in Orange County. I specialize in women's health, infertility, pain management, so many things, but that's kind of my favorite thing to treat. I have been practicing for 10 years now. It's been a very long time, but so fun. This is how I met Jamie. And Jamie, you want to give an intro?
Yes, I'm Dr. Jamie Lesser. I'm a licensed psychologist here in California and with a group called Unfiltered Therapy. And we provide evidence-based treatment for those that struggle with anxiety, depression, OCD, but we're really passionate about maternal mental health. And so everything related to fertility, loss, prenatal mental health, and postpartum mental health.
I feel like that's definitely our topics of choice if we had to choose, but we're just here to kind of chat about our favorite subjects. We've been doing this for a long time. Jamie was actually a patient of mine, so this is how we started chatting. I think every time you come in, it would be like an hour and a half treatment.
I know. So it would be like the treatment, and then we talk about and everyone have to go back to school. No, I'm not ready for my nap.
Yeah.
No, I just want to talk some more.
But it was really fun because we were able to talk about, you know, so many things, like especially since you specialized in maternal mental health, I was able to send a lot of my patients to Jamie, and then also vice versa. Like we were able to co-treat quite a bit. So that's where we came up with the idea to, you know, start just like a little, you know, fun reel to kind of educate our patients on what it is that we like to treat, what it is, you know, our most commonly asked questions, and see, you know, what my answer would be coming from a Eastern medicine perspective, and then Jamie's coming from a Western maternal mental health perspective as well.
Yeah, I mean, I feel like we talk so much, we might as well just make videos about it.
Exactly. At this point, I'm like, whoever wants to hear us, absolutely.
Yeah, why not, right?
Yeah, so I guess like the most common question I get is, what does acupuncture do? So I guess I can answer that.
Yeah, I should answer that. Right?
Yeah. And then for you, I think what's the most common question, I guess, is?
I think what I see most, not necessarily question, but presentation-wise, is just kind of like, how do I deal with this uncertainty around infertility? So I think that's something that I really want to talk about today.
Absolutely. So a lot of people ask me what acupuncture does and how it helps. So from like a Western perspective, there are two sides to it. The first side is the Western side, and the second side is the Eastern, right? Eastern is kind of what I grew up with. I grew up with Chinese medicine, I grew up with Vietnamese medicine, I grew up with herbs, cupping, things like that. And then as we learned and progressed, I realized that Eastern medicine is actually just very similar to Western medicine in that it just kind of has a different language. So the way I explain acupuncture is, from the Western side, when you are inserting a needle into a certain area, what it's doing is it's opening up sensory receptors and increasing dopamine and all the serotonin, all the good, feel-good hormones, essentially. In Chinese medicine, when you translate that, that means like, you know, you're moving qi, you're moving blood, you're moving stagnation, right? So essentially it's very similar. The two go hand in hand. But the problem is that I think because we have different languages for it, people are like, what does that mean? But essentially it's very similar, right? So with acupuncture, the reason why it's so helpful in women's health is because it works on like amenorrhea, dysmenorrhea, which is like lack of period, painful periods. We focus on regulating cycles. We help with infertility, especially with ovulation, implantation. And then, of course, if you want to go a little deeper, we also do like IUI, IVF support, and a lot of like herbal consultation as well too. So that is like the blanket of what acupuncture does. When you go like a little deeper, there's so many pockets of it, but we can kind of break it down piece by piece.
Yeah, I mean, I remember when I was doing it, when I was struggling with my own, you know, fertility journey, I felt like I learned so much more about my cycle from our conversation.
Yes.
You know, because I think we just kind of taught how not to get pregnant.
Yes.
And we're talking.
It's almost like red flag. Stay away. Don't have sex. What the Mean Girls?
Yeah. Right.
Don't have sex. You'll get pregnant.
Yeah. Exactly. And it's like, what's ovulation? Like, oh, I can like get pregnant like that. I remember actually before I was trying, I went into it very naive.
Yeah.
Just thinking I can have sex one time and I'll be pregnant. And that was not my journey whatsoever.
Yeah.
But learning about my cycle, you know, I feel like I learned more about it in acupuncture than I did, you know, from Google, honestly.
Or even like, you know, when you were a kid, like in elementary school when they're supposed to be teaching you about your cycle.
Yeah.
And I think that's like, I think once you learn about your period, then it feels so much more empowering. Yeah. Like you feel like you know a side of yourself, or you can understand why you do the certain things that you do, right? And like when I educate women about like their follicular phase, their luteal phase, their ovulation, you know, things like that, they're like, wait a minute, that's why I feel hot, that's why I'm breaking out, that's why I'm moody. It's not just because I'm crazy. It's like, no, you're not crazy. It's your hormones that are dictating a lot of these things.
One of my favorite things that you talked about and posted about was the workouts based on what phase you're in. That was so cool. Can you talk a little bit about that?
Yeah, absolutely. So my favorite actually is when I look at a cycle and a lot of women come in to see me and they're like, oh my gosh, like I just did a HIIT workout every single day. I don't know why I'm so tired. I'm so gassed out. I'm like, it's because, you're in different menstrual periods throughout your cycle, right? So hypothetically, if your period is like a 30-day cycle, 28 to 30 days, technically you break it up into like 3 or 4 parts, right? So the first part is your follicular phase, which is when you are more estrogenic, you have a little bit more energy. That's kind of when you feel the best, right? So that's when I tell my patients, like, hey, do your HIIT, do your spin, do your like intense walks, whatever you want. And then when you ovulate, pretty much the second you ovulate, your progesterone kind of rises and then it drops, right? So then you're at this point where you're like, oh, like things are starting to shift a little bit. You usually feel like your peak, they say like in studies, it's like that's when you PR. So it's when you get like your highest like max rep, like when you're doing things. It's the best when you are working out and you want to run a marathon. It's like the fastest you'll probably go. But then once you hit that luteal phase, your progesterone rises and it's like, hey guys, like, I'm gonna let you know, we're gonna slow down a little bit. But that's because technically your body's supposed to be implanting to get pregnant during that part, which is after ovulation. Once that happens and your body runs hot, you break out, you're more like, you're more tired, you have more low energy. Why? Because you're supposed to be resting. You're supposed to be resting so you can technically get pregnant. And then once you realize you don't, boom, you have a period, right? And that's when the PMS comes and all those symptoms come. So I always tell people, like, if you're gonna work out during the luteal phase, I want you to be doing a lot of yoga. You want to be doing more Pilates, like slow walking, things like that, so you can kind of support your body in a way that's healthy. And when I posted that, everyone was like mind blown. They're like, what? Like, I thought you could do a HIIT workout every day. I'm like, yeah, if you're a guy and your testosterone levels are straight. But for us, our estrogen and progesterone levels change monthly. And not only monthly, it differentiates month to month. So sometimes some people are more estrogen dominant. Some people are more progesterogenic. Some people, are about to be perimenopausal. So they're experiencing all these symptoms that are very, very difficult, and we just put it on ourselves like, oh my gosh, we're going so crazy, I'm so sorry, I'm being crazy, I'm so sorry, I'm like not feeling good. When in reality it's like our bodies are telling us like, hey, we don't feel good, we need to slow down.
I mean, it takes so much to create a baby. Like, our bodies are very complex. And
Absolutely.
I think it's really cool personally, but it creates a lot of these ups and downs. And I mean, actually, some of my patients, they're able to notice mood changes based on where they're at in their cycle. It's not just that typical, oh, I feel like I'm on my period and I'm angry, but they definitely describe a lot of difficulties around ovulation.
Absolutely. Ovulation is funny because people don't think that like you feel anything during ovulation, but actually some people will feel like more cramping because you're actually ovulating. You can feel the egg leaving the sac and like kind of going down and being like, hey, are there sperm? And then there isn't, so it's like, boom, you get a period. But essentially that is also a secondary time when people will feel like cramping. And the more you are in tune with your body, like most of my patients who've done acupuncture, I never noticed it until I started doing acupuncture and being more aware.
Same. Like I didn't really understand the concept of ovulation until I wanted to ovulate, and then I was like, damn, this is uncomfortable.
Yes.
And then you feel the like after ovulation stuff. It's just your body is working and it's working really hard. And so you have to pay attention to where you're at.
Absolutely. And I think like the more you are in tune with your body, again with acupuncture, you're supposed to be resting for like 30 minutes, right? That's when you're supposed to be meditating, like responding, checking in with yourself and being like, how do I feel today? Like, do I feel tired? Do I feel, X, Y, and Z? And these are things that we don't really think about when we're so busy.
Very true.
And as women, I think we just, if everyone's seen the Barbie movie, it's like, we're just trying to do it all, but we can't. So we need to slow down, and it's very important. And that's why, like, with you, I think maternal mental health and just mental health around fertility is so important, because people are either asking like, are you getting pregnant? Are you pregnant yet? When's your second? If you are pregnant, it's like these really heavy topics.
Very heavy, and it's all around us, right? Because if you're watching this, then you're on social media, and when you're trying to conceive, and there's these announcements, like we see them all the time when you reach a certain age, and it's like, oh, nope, okay, there we go. And
it's like clickbait, but like in a not good way sometimes.
No, because you're not announcing, but you want to be. I think one of the things I definitely would want to talk about is when I was trying to conceive, I thought that planning was the way to do it. I'm such a planner. I'm such a type A person. It's like, what do you mean? I'm eating the fertility diet. I'm going to acupuncture. I'm doing all of these things. What's happening? Why am I not pregnant yet? And so it can create a lot of stress. Like it can create a lot of anxiety. But what I see a lot of that we don't talk about is a lot of OCD behaviors. And so it's repeatedly testing, because there's so many ways to track. You know, you can track with basal body, you can track with ovulation strips, but it's not just like the cheap ones, but also those really complex like programs now. And
the Aura ring, it's like you wake up and your body's like, oh, like this is your temperature, so it can kind of make you a little cuckoo.
It really can. And you know, and then your basal body temperature changes. It's like, oh no, I can't get out of bed yet, I need to check my temp. You know, I remember going on a trip and taking my big fertility tracking thing with me on, you know, to fly. It was just like, it was totally consuming.
It's also like just always at the forefront of your mind, essentially, for patients.
It really
for people.
is.
Yes.
It really is.
Yeah.
And so trying to conceive is truly the practice of letting go. And now that I am a mom, I recognize that it preps you for motherhood, because once you have a kid, you very quickly learn, oh wow, I have no control over anything. This thing's running my life.
There's a lot more go with the flow than you'd expect.
Exactly.
Yes.
And so it can be really reeling when you're tracking your cycle and you're doing all of the things. And so it's very important to keep that balance. Like, of course you want to seek out support. Like, I'm so glad that I did acupuncture, but it can start to become an obsession.
Yeah, absolutely. And how do you, like, I guess, like, for me as an acupuncturist, I get asked all the time, it's like, how do I break out of this obsession? Like, what's the secret?
I think the secret is balance. You know, it can't be everything. It can't be your entire life. Like, because even as a mother, being a mother can't be everything, right? Like, I have to.
It can't be your entire identity.
Exactly. I still have to have that piece of myself. You know, we've lived lives before we've created life, and so keeping that in mind. Also, when you're trying to conceive, it's like, yes, I want to track this, or, you know, maybe I could be pregnant, so I want to, you know, maybe, you know, keep it safe a little. Or do I want to book this trip in a year out if I'm trying to conceive? Well, it's not guaranteed you're going to get pregnant by then. So if you want to go to Spain. If you want to have a drink, you know, have a drink.
I follow the 70-30 rule, like, right, 70% of the time I'm pretty healthy, right? It's like, I tell my patients, like, do the gluten-free, do the dairy-free, but the 30% on the weekends, like, go have fun, like, have a drink with your friends. Like, I mean, I don't support you blacking out, but I support you having a drink so that you can enjoy with your friends, your family, have a piece of cake. Like, I had a patient who one time came in crying because she had a piece of chocolate. She's like, is it gonna ruin my chances? I was like, absolutely not. Like, chocolate, if anything, boosts your serotonin, your dopamine. Have a little bit of chocolate, guys. From your acupuncturist, you can.
That's the thing, right? It's that, if I do this one thing, will I get pregnant or will I not get pregnant? And that's our brain trying to understand this lack of control. It's like whenever we experience something that's outside of ourselves, we're trying to grasp at control. Like, maybe if I did it differently this way, then I'll get pregnant. Well, maybe, but maybe not. And that it's just creating this life where you're trapped. You're trapped by these, you know, these thought processes, and you're also just like trapped by these over control
and like rules that you like made for yourself.
And those rules can be very isolating. I mean, struggling with fertility is a very isolating experience.
Absolutely.
You know, because I saw very close friends around me getting pregnant, and especially when you experience loss, you know, like a miscarriage. And, you know, you get really excited and you confide in a friend. And their pregnancy continues and yours doesn't. It's a very lonely experience. And so we're not only trapped in our rules and, you know, this becoming our entire life, but we also become socially trapped.
I think the thing that's also tough is that when we see patients who feel paralyzed and stuck in this space, like, I think the thing is, like, you know, people ask again, what do I do if I feel stuck? It's like, then you have to create room to be unstuck, right? You have to be proactive even though it feels like you can't. And we're not talking proactive into like, do more basal body temperature, like pee on a stick even more. It's like, the reason why acupuncture is so beneficial is because it gives you that hour to yourself where you can truly check in and be like, you know what? I want to pour into myself first before I can create life, right? And so it's like the circle of life. If you don't do that, then what ends up happening? You are pouring from an empty cup. You're creating from, you know, dry soil, and that's where your body is just not in that space.
Yeah, and it's so interesting, right? Because then people think like, oh my God, I'm too anxious. Now I'm definitely not going to get pregnant. It's like, no.
It's like a double-edged sword.
It is, right?
Yeah.
Obviously you want to be in a good space because we know that when we're experiencing anxiety, we're releasing a lot of stress hormones, which isn't great for us.
Yeah.
But also you can't control everything. If something bad happens in your life, if you lose a pet or, you're experiencing stress at work, that doesn't mean you're not going to get pregnant. There isn't a causal association.
Absolutely.
And
that's a very Western thing.
It is.
So being
interesting.
an acupuncturist and also being Asian American, it's very fascinating to really think about how Western medicine is very this plus A plus B equals C.
Yes.
Right? It's very Western.
Yeah.
So it's if I eat this chocolate, therefore I won't get pregnant, therefore it's my fault. So it's a very circular argument, right?
Yeah.
But in reality, when you look at Eastern medicine, everything is qi flow. If you look at a qigong artist, everything is there's no start, there's no stop, there's no beginning, no end, right? There's things that just keep going and moving. And the theory of yin and yang is that it's supposed to be all about balance, right? And if you look at the symbol of yin and yang, it's there is a circle that has a black dot in it and it's split in half. There's a black part of it that also has a white dot. Why? Because there's still pieces of black and white in the bigger picture. It's not just cut in half and that's it. It's because everything flows together, seasons move together. And so I think there is something to be learned about, the flow and balance when it comes to Eastern medicine.
Oh, absolutely. And, with the way that I work, we look a lot at the yes and, right? And so there's always an and. Yes, this might be true, but this can also be true.
Absolutely.
And they can live together and,
they can coexist.
Absolutely. And it's always about trying to find the gray and moving towards
we don't like gray. Gray is not people's favorite color.
No.
We like white, black, or some people like red flags, right? So it's
gray did have a moment for interior design. But it's that flexibility, right? And so when we think about trying to conceive, when it comes to, the disappointment and when you're dealing with loss and all of that, it takes a lot of resilience to continue that journey. And resilience is fueled by flexibility.
Yeah.
In order to be resilient, you need to be flexible.
Woo! Say that again.
Right?
In order to be resilient, you need to be flexible.
Yeah. And that's flexibility across everything.
Yes.
Right?
Yes.
It's we can't control the world and we can't control our bodies. Our body is going to do what it's going to do.
I guess then the question is for my patients, I always ask them, what can I control?
Yeah.
Right? It's but again, there's a balance, right? You can control a lot of things. You can control your diet. You can control what you consume via social media. You can control the people you surround yourself by. You can control what you read, what you digest, what you put in your body, the time that you go to bed. These are things that are very controllable. And I think if it's done well and done with a flexibility, then it actually helps you. It hurts you when you do these things and you're if I control all this, A plus B equals C.
Yes.
And
it's that divide, where you can't find the other end of it, right? Where it has to be this way.
Yeah.
That's where we get really stuck. And when you get stuck, you're not moving forward.
Yeah. What would you say, if I were a patient who was struggling with infertility, and I was I need help, where would you start with them? What would you ask them? What are the things that you would do in an initial intake, I guess? Because some people are so scared of therapy.
They are. I think for me, I look at the infertility experience, as in a grief and loss kind of context.
Ooh, okay.
Because
I've never heard that.
Yeah, because when you think about it, it's we as women, we receive these messages that's becoming a mother, right? You see little girls carrying babies. It's
an instinct.
It is. And, I know in my family, you constantly, when are you going to have a baby? When's the baby coming?
You're part Asian.
Exactly. it's a thing.
We're very pushy.
Absolutely.
Yeah.
But, it's questions that you receive all the time, and it's just assumed that you're going to be a mother.
Yeah.
That's going to be your experience as a woman. And so, as you're trying to conceive, you are kind of grieving that expectation and that piece of you where you always imagined that you were a mother, and you're it's delayed and it's out of your control, and so it's a loss experience, and it's also quite traumatic. When we look at trauma and what creates PTSD is always, not always, but it's typically, it's pushed by this sense of feeling like a victim, you didn't have control in this situation, something bad happened to you, and there's nothing you can do about it.
Yeah.
How traumatic is it when you're trying to conceive and you have absolutely no control.
Yeah.
It's a complete loss of control.
Yeah.
And again, so many people that struggle with fertility, they often experience miscarriage.
Yeah.
Which is,
People don't talk about that either.
no,
Absolutely.
they absolutely don't. And I
Yes.
think it's really sad. I remember when I was in my journey, it was something that I chose to never keep a secret, because people would be, when are you having kids? And I would say to them, I would like kids, you know, like I'm trying to have a baby and I had a miscarriage. And it kind of stopped people in their tracks because it was almost socially inappropriate.
Yeah.
But no, it's socially inappropriate to ask me that question. Like,
Ooh,
maybe you
yes.
should think first before asking me.
Because sometimes people ask, but they don't want to hear that answer, right?
No.
They have an answer that they want you to say,
Yeah.
like, "Oh, I'm trying," you know.
Yeah.
And it's great, and life is great,
Yeah.
but
One day,
Yeah.
we're hopeful.
yeah, but screw that.
Uh-uh.
Actually, like the real answer is like, this sucks. I've been crying all day.
Yeah.
Like my body hates me. I put a million injections into my body, and I'm bloated, crampy, and I had a miscarriage last week. Like,
Yeah, how's
Yeah.
it going?
yeah. And then everyone's like,
Yeah.
"Oh, that's
I
not what
know.
I expected."
I know,
Yeah.
but I think it's so important to talk about because
Mm.
it is the experience for a lot of people.
Yeah.
Especially because, as we know, when we're in California where it's
Mhm.
incredibly expensive, I can't, even as a married person, not work.
Yeah.
Like, we, you know, we go to school,
Yeah.
we get these student loans, and we get these careers. It's like, when is the right time to have a baby?
Yeah.
And that time keeps being pushed back further and further and further. Well, we know that, you know, the younger body tends to get pregnant more often than the older body for some reason.
Statistically.
Yes,
I
statistically.
put air quotes because,
Yes.
you know, I had a patient last week who's like, she's like 43, she got pregnant, so I'm not gonna say anything, but you know.
Fantastic. It happens, and I'm
It
glad it happened. I was
Yes.
a bit older, right? But I think that we learn that egg quality starts to decrease, and same with like the amount.
Yeah.
But like, so a lot of people,
Mm,
you know, it's not just trying one time.
no, and I think that's where when people come in, the next question they always ask me is, so how many acupuncture appointments do I need in order to get pregnant?
Oh man.
And I'm like, that's like saying, how many therapy sessions do I need to be healed? It's like,
They
are you
ask,
ever
and
healed?
that's the question that's asked.
Yes, it's like, are you ever healed? Like, does pregnancy
Yeah.
ever solve the anxiety? Not really.
No.
If like we know with anxiety,
Yeah.
it just creates a different beast, right? Like it transfers. And so when people ask me, they're like, how many acupuncture treatments do you need to get pregnant? I'm like, well, what's your body look like? What's your body telling you? Like, how healthy or unhealthy is it? You know, what have you done to prepare
Mhm.
for pregnancy? You know, it's almost like saying like, can I run a marathon in 6 minutes? It's like, in theory you could, but how much did you prepare for it?
Yeah.
If you ask me right now, there's no way. Like all my patients who are runners, kudos to you, but I could never, right? It's like,
Yeah.
I haven't trained, I haven't prepared,
Yeah.
I haven't done any of the things, you know? So with fertility, I always tell people, you need at least 3 to 6 months prior. If you want to get pregnant next year, it's time to start now, right?
Yeah.
And to start looking into supplements, like looking into acupuncture, looking into, you know, therapy, looking into wellness management, because if you can't do those things, are you really in a space? I mean, that's a really loaded question, but are you really in a space to be pregnant? Because it takes a lot in order to, you know, travel that line and to kind of pass that line and to run that marathon.
Well, and also, right, again, like, to be a mother,
Yeah.
right? And
Yeah.
so you, as a mother, you have to prioritize self-care.
Yeah.
You absolutely have to. And so
Yeah.
I truly believe that the struggles that we experience while trying to conceive actually kind of flow into the struggles that come in motherhood.
I mean, it is, again, if we're talking circle of life
Yeah.
and yin and yang and the flow of things,
Yeah.
like that is generally how it works.
Yeah, and also, you know, when people have been struggling with fertility and they get pregnant, they think that when they get pregnant, they're going to, all the stress is gonna go. But
That is my favorite. When people are like, when I get pregnant, I'm gonna be great. Like all the anxiety is fine. I'm like, oh yeah, what about when you deliver? What about when you have a C-section but you don't want a C-section?
Yeah.
What about when you have a breech baby and the baby doesn't turn? Like, you're not gonna be anxious?
But what about
Yeah.
the first blood test where you gotta do the
Uh-huh.
genetic testing
Yep,
and the first ultrasound and
Mhm.
listening to the heartbeat and the anatomy scan? Like all of the things, when you're pregnant, there are all
Yeah.
of these tests and all of these exams and all, you know, and you get attached to this life very quickly, especially if it's something that you've been trying really hard to create.
Yeah.
And so at each step, it's like, oh my, I hope this baby's okay. I hope this
Yeah.
baby makes it.
Yeah.
You know, and so something that I treat a lot of is prenatal anxiety because it is a very.
I send a lot of my patients to her
Yeah,
for that.
yeah.
I'm always like, you got anxiety? Go see
Yeah.
her.
Yeah, I mean, it's a scary experience. Because again, that's another thing we have no control over. We have to trust that our body does the right thing, but how do you know for sure?
Yeah.
How do you know that this fetus is going to make it? You don't know.
Yeah. And I think, again, that's uncertainty, right? That's not being able to control anything.
Yeah.
But I think that's the whole point, right? Like when it comes to fertility, when it comes to motherhood, when it comes to anything, like how much control do we actually really have? Control is a figment of our imagination and things that we have created for ourselves in this society. But I think if you really tap into Eastern medicine and you look at like, you know, Buddhist monks and like, you know, people that have really spent years meditating, they're like, we can't control anything. Like the baseline is like, we can't control shit.
Ever.
So how can we manage the fact that we can't control things?
Yeah, surrender. Right. You have to surrender. I think it's, you know, in what I do, there's this concept called radical acceptance. And so radical acceptance is having to radically accept that something has happened or we have no control. And it doesn't mean that it's okay. It just means that accepting that reality is so much easier than fighting it. Because when we're fighting it, right, we're blocking ourselves and we're getting in our way of actually meeting our own needs.
Yeah.
But when we can accept something, then we can listen to ourselves and we can validate those emotions.
I like
because
that.
we're actually in it versus fighting from here. You can't fight things from here.
And say that term again. It's called radical acceptance. That's a really good phrase. Now that I'm like really sitting and meditating on those words, like to be able to accept something. Like acceptance seems very just like, oh, you should just accept the way it is. But it's like to radically accept something means that you are kind of taking just acceptance, but like making it a mindset instead of just like one event, right?
Yeah, it's like, this sucks, and you're allowed to say this sucks, but it's also reality. Like, and I have to accept this because I don't want this to be my entire existence. I want to be able to live a life.
I think the stress and anxiety comes from pushing against what we can't accept.
Yeah.
And so it's like it's from this need to control, and because we can't control, then we like perseverate on it. We think about it, like we dwell on it. Yeah. And sometimes you just need to let it go.
Yeah. No, absolutely.
Yeah.
And the only way to let it go is to accept that it needs to be let go of, right? And if you can't do that, then you can't let go of anything. Then you're just in this endless hamster wheel of suffering. And the only way to end suffering is to accept.
Yeah. With acupuncture, I've definitely seen and treated patients in that space, right? Because I think with acupuncture, there's so much, not just physical, right? Like, of course, there's an elbow we can poke in, or like, you know, it brings down inflammation, whatever. But I think my favorite part about acupuncture is that there is this kind of emotional piece to it. So I love doing a lot of like central nervous system deregulators, where it's like, you know, to de-escalate that kind of cortisol level that's been building. My favorite point is the one I always do on you. It's this guy right here. Sometimes it's a little spicy, but everyone's done it. Like I do it on myself. But it's kind of like when you like frown, right? Like that's kind of the point. And it's like, it's a good way to kind of release the third eye, the intuition, and just to allow yourself to kind of turn off. And then I have a few more points like on the back of the neck, like the occiput, which are so nice. Like once I put a needle in, everyone's like, I just feel like I want to stab it with a pencil this whole time. I'm like, yeah, probably because it's very tight, you know, and by doing certain physical points, it also alleviates the emotional. So together, it's such like a really nice duo.
I mean, I've loved being able to send my patients to you, especially the ones that are very anxious. Or because for a lot of people, they experience their anxiety physically. And, you know, even
like
when
somatic responses, the shortness of breath.
Absolutely. And even in the diagnostic criteria for generalized anxiety disorder, there's actual physical symptoms, right? So there's GI distress, there's headaches, difficulty sleeping, and those are physical experiences. And through, you know, cognitive therapy, meditation, and all of that, like, yes, we can bring those symptoms down, but it is so helpful when we can also address it physically. You know, that's why I sent a lot of my people to you.
It's also interesting because during the pandemic, there were so many patients who came in and told me that they went to the ER because they thought they had a heart attack
all the time.
And everyone was like, I have a heart attack, I'm gonna die. A lot of times my male patients are not gonna say nothing, but I'm just saying.
Your male?
Yes.
It's also it's really funny.
They're like, I'm gonna die. I have a heart attack.
No, it's really funny because if I get an older male, and not old, but like an adult male that's never been in therapy before, they are typically very successful in their careers.
Yes.
But they went to the ER for a panic attack.
But they don't know it's panic attack.
They don't. They think they're having a heart attack every single time. And they are some of my favorite patients to treat because with panic disorder,
Yeah.
we use cognitive therapy, and so it's like being able to challenge the cognitions, challenge their thinking. But the critical thing about panic disorder is exposure therapy. And so whenever someone has panic disorder, they avoid situations or physical sensations that elicit panic symptoms, or their brain tells them is a panic symptom.
Yeah.
And so by having them do those things, so like work out, for example, to go into a crowded place, you know, like
things that trigger them.
Absolutely. And so we expose them to that with their skills.
Yes.
And then they can, their body and their minds learn like, oh, I'm not actually in danger anymore.
That is fascinating. It's almost like a histamine response, like right when you're allergic to something, you have to kind of introduce the allergen.
Yes.
Like
You're
over and
not
over again.
Well, it's inoculation, right? And that's actually what vaccines are. It's inoculation. And there's this old school kind of therapy called stress inoculation training, where it's kind of like building the ability,
stamina to withhold stress. Yeah. That's what I would call it. That's fascinating.
It's really interesting.
I think that's why with acupuncture too, when patients are in the room, sometimes I'll do certain points and then they have like a full somatic response.
Yes.
Like they will come in and they're like, oh my gosh, like I felt like during treatment my heart was gonna like pull out of my chest, but then like 10 minutes later it just kind of calmed down and it relaxed. And they were able to say like, okay, you know what? Like it wasn't the end of the world. I had that almost like a rush or response, and then your body was like, wait, it's fine now.
Yeah.
That's so fascinating.
It is. It's being able to experience it, right? And it's with anything, like again, like going back to fertility, like being able to really experience the disappointment, the sadness,
to feel it.
Yeah, to actually feel it is how you can address it. And if you can't validate your own emotional experience, there's no way anyone around you's going to be able to do it. It's not going to happen.
Because I think if you don't create time to validate it, right, and space, right, which is I think that's why a lot of my patients, I look at you guys know who you are. It's the one where it's like they like lay in the room and they're like, it's been 10 minutes. Like I'm gonna like jump out of this chair, get me out. That felt like 6 hours. I'm like, girl, that was 10 minutes.
I know.
Like chill.
My favorite was being on the table and like, I don't know if I'm able to fall asleep, and then I wake myself up with a snore. I'm like,
or I'm looking at you snoring.
I know.
Yes. But that's also because, you know, like you realize if your body's finally able to relax. And once it's able to relax, you wake up and you're like, whoa, like I got the best like cognitive, you know, rest that I've had. Like my brain actually turned off. And it never turns off. Like, you know, if you really think about it, for the most part, we're always doing something. We're on our phones. We're like looking at things. We're ovulation test kitting. Like, you know, like all day long. We're looking at our aura ring. We're looking at our stats. And it's like sometimes you just need to chill the F out and sit.
I know. And it's funny that like after acupuncture, little haze, like a Taylor Swift lavender haze. Like, just like this little like haze. You're just like,
I call it lavender high. I feel like it's an acupuncture high.
Yeah.
And some patients tell me afterwards like, they can't drive or like they just need to sit for a minute. I'm like, that's okay. Like, I know. I like some people will come in and be like, give me the sedative points. I'm like, I got you. Like just lay down. You know, and it helps, but it's like a good pairing. And I think, you know, in the dream world, I think it'd be wonderful if we did acupuncture and like, you know, cognitive behavioral therapy like in the same room, right? Like imagine getting acupuncture points while doing like therapy, but you know, like it's close if you do it together in the same week. It's like so powerful.
Absolutely.
Yeah.
I agree.
A lot of people who see both of us the same day or the same week will be like, oh my god, I had so many revelations or like so much more peace afterwards, or it's, you know, so much more challenge, right? Like they were able to really, you know, do the work with you, come into me, and then take that time to process and meditate on it, and then come out and be like, hey, like this is where I'm at. I tell them a lot of times to journal afterwards, to like brain dump is what you call it, when you just like sit down and write all the words and all the things that come to mind, and then you highlight the things that are, you know, the most important, right?
So no, I think just figuring out how to get it out, whatever that looks like. I'm a talker. Like I love to talk through things. Like getting myself to write through something is really difficult, but you know, talking through. But for some people, it's the opposite. They don't want to talk about it. They want to be able to write, or you know, like a solid meditation experience.
Oh, I have so many patients who hate talking and hate writing and hate, so they're internalizers, right? So they keep everything inside. That's why acupuncture is so amazing, because they actually feel like for that hour they're able to, you know, go inwards and go deep and to get to that space. And so it's important for in all ways in that way.
I agree. Well, this was fun.
Yeah, I had such a good time. This was a good chat. And so hopefully, you know, we can keep going. I think our next time we will probably answer a few questions that are pretty common or popular, then just see where it goes.
Yeah, I think definitely talking about the postpartum experience too, because you know there are patients I've sent to when they're postpartum because like we spend so much time prepping the body for pregnancy and then you know that support during pregnancy, but what about after?
Yeah.
So I think that would be a fun thing to talk about.
Yeah, because we talked a lot about preconception care.
Yeah.
Like during and postpartum is also very hard. Postpartum is like another chapter. Like all my mamas, you guys are. I know. We take care of you. I know, but